Ladies and gentlemen, please welcome to the stage Nancy Brinker, co-founder, Promise Fund of Florida.
Thank you. Good afternoon, and I'm so happy to be here participating in the Concordia Summit. And thank you to Matt Swift, his entire team at Concordia for inviting me. Throughout the day, we've heard from global leaders on the importance of working together to solve the world's problems and support our communities, especially women and girls. No one has championed this more than former First Lady Laura Bush. Congratulations, Mrs. Bush, once again, on the recognition for your leadership and dedication. The First Lady said it best: we must choose between a world of fear and a world of progress. We cannot stand by and do nothing while dangers gather. And we are now, more than ever, at a crossroads for humans to come together and act as we face unprecedented dangers. One of the greatest of these faced by women around the world is increased mortality. While women's health has been on the back burner for policymakers even before COVID-19, the facts are that women and girls have been severely impacted by the virus and its effects, such as higher unemployment, poverty, and missed preventative care. This second pandemic is concerning not only for women, but really for all of us. Take breast cancer as one example. Screenings were down by as much as 98% in the United States alone among historically disadvantaged populations. The World Health Organization estimates that reducing global breast cancer mortality by 2.5% would avert 25% of breast cancer deaths by 2030 and 40% by 2040 among women under 70 years of age. And that early detection and regular screenings are two of the three pillars to achieve this. Saving the lives of 2.5 million women per year means more income, stronger families, and thriving societies. But these are numbers, however shocking, and breast cancer is an intensely personal disease that affects individuals, families, and societies. Mrs. Bush's mother was a breast cancer survivor. And when I started Susan G. Komen 40 years ago, after my sister died at the age of 36, Mrs. Bush was one of our first volunteers. I founded Susan G. Komen and now the Promise Fund of Florida because I saw closely and close up how bravely my sister fought this battle and how it affected those who loved her. Even saving one life with more focus, more attention, and greater care will have an impact on so many. So how do we start to face these dangers together? Without clear data and an understanding of the factors that can help leaders address and improve women's health, where do we begin? Well, my good friend, Steve McMillan, President and CEO of Hologic, has not only recognized this issue, but has found a way to close the gap. With Hologic's more than 30 years' experience in women's health and Steve's own deeply driven personal dedication, he's partnered with Gallup to create the Hologic Global Women's Health Index, a multi-year study of women around the world identifying gaps, but also a way forward to help women live longer and better. The partnership with the private sector to confront these dangers cannot be underestimated. We cannot improve what we cannot measure, and we are long overdue to improve the health and well-being of women everywhere. I'm proud to introduce Steve McMillan to you to tell you more about how we can put data and science to work and help make a difference for women everywhere. Thank you.
Thank you, Nancy. Thank you. In 1971, exactly 50 years ago, when I was just a young boy, a little-known performing artist from Australia penned the following words to open a song. I am woman, hear me roar, in numbers too big to ignore. Yes, many of you have come to know Helen Reddy's song and the hit that it became and what the voice of a generation and the voice of a movement. And that song has had a profound impact on many of us. It became a big hit in 1972. 10 years after that, I was sitting as a teenage boy about 30 miles southwest of here, as my sister became the first in our family to graduate from college. She graduated from Douglas College, which is part of Rutgers University in New Jersey. And I was sitting in the audience when Jane Pauley delivered the commencement speech. And Jane was speaking about, and it was a poignant moment, she was telling all these young women graduated from college who'd been told you can have everything, that, hey, there's still some barriers we all have to work through and challenges we as women have to deal with uniquely. And probably not many teenage boys were impacted by that speech or Helen Reddy's song the way that I was, because I was raised by a single mom and that older sister of mine who was graduating. And so I probably grew up with a deeper passion or understanding of the challenges facing women. And as fate would have it, many years later, I happened to end up at Hologic, which, for those of you who don't know, is a medical technology and diagnostics company with a profound focus on women's health. Things like mammography, HPV screening, STI testing, all kinds of things. And that has been our raison d'etre. So what's been fascinating as I've been leading this women's health company and then looking at women's health, because for all the progress we've made in the last 4 or 5 decades, women's health around the world, to me, is still woefully behind. And if not for, frankly, if you think about Nancy Brinker's energy in creating the Susan Komen Foundation and the Pink Ribbon, that's probably one of the few things we can really point to where there's been big progress. And so as a diagnostics company, our team spent a lot of time thinking about how can we make a bigger difference in the world than just the products we sell. And it's by creating the diagnosis, which in this case is the data that has never existed on women's health, not just qualitative, but quantitatively around the world. And so we partnered with Gallup, and over the last year and a half, and really most of it during last year, conducted a comprehensive study that we're calling the Hologic Global Women's Health Index. And this is the start of a study that we will repeat every year going into the future. Because in our mind, great treatment begins with great diagnosis. And so we hope to provide a roadmap for policy leaders and government leaders around the world. Because to finish with a quote from Helen Reddy's song, and the final words before she goes to the refrain, many of you may remember, and I still can't think of any of these words in my head without her powerful voice and the tune going through my head. I don't dare sing them because that just wouldn't work real well. My own daughter, when I was singing her songs at night, used to put her hand up. No, Daddy, that's enough. But she finished that song with, I'm just an embryo with a long, long way to go until I make my brother understand. And we hope the Hologic Global Women's Health Index can become the vehicle to help our brothers understand. And by brother, in that case, we mean policymakers, leaders around the world. Because as we can help make it understand, we can develop the pathway forward. And so at the end of the day, it is so critical that women's health is not just about women's health. It's about all of our health. It's about global health. We hope you will all join us on this journey. Thank you very much.
Please welcome Paige Cunningham, Washington Post, and Monica Ginkos, First Lady, Republic of Namibia.
Well, thank you, and I'm looking forward to this discussion, and thanks to you both for being with us today. And we're going to be talking about women's health in the post-COVID era, in particular, what we've learned through the pandemic of the vulnerability of women, particularly when a disaster like this strikes, and how we can move forward to improve the well-being of women around the world with policies. And so first, Steve, I'd like to ask you more about this index that you mentioned. And can you share a little bit about kind of the mechanics of how this is going to work? You're saying that this is going to involve many countries. Sounds like a lot of hours of work to collect this data, but how is that going to happen?
Sure. Because we're not experts, we're experts at developing products and servicing and innovating typical R&D stuff. We didn't know how to do this. So we reached out to the Gallup organization. Obviously, many of you know, Gallup is phenomenal. This is exactly their core competency, is running polls. And they run something every year called the Gallup World Poll. So we partnered with them and specifically added a whole section that this was entailed 120,000 interviews in over 140 languages in 116 countries, such that we could get global data, but also break it out at a country level basis. Because what we really hope to be able to do is give the policymakers in each country a little bit of a roadmap, or certainly the beginning data. So it's all really done by Gallup, with us in the background partnering with them, but us championing and helping to make it happen.
Well, and I saw that Gallup had a story this morning even talking about that they'd found that only 12% of women worldwide said they were tested for any type of cancer in 2020. What are some of the other indicators that you're hoping this index will include? What are examples of some data points they're collecting?
Yeah, I mean, that's a staggering number when you consider 10 million women died of cancer last year around the world, and only 12% were screened. You know, we found that over 1 billion women on the planet last year, 40% of all the women that live on this planet, did not see a doctor last year. And so it's some of those things. Then we get into specifics about were they, were addressed for cancer, for diabetes, for sexually transmitted infections, for high blood pressure. So we go into a lot of the individual conditions. We also ask things around, frankly, domestic violence. And, it's a much broader study around all of the things that affect really women's longevity and both quality and quantity of life. So, Gallup brought so much of the good thinking to the equation, even all the subtleties. They know how to ask questions. It's very challenging, particularly in a lot of these areas, as you're asking those questions, to know how to get the best answers, and that's where professional, poll takers and information gatherers is very different than a company just trying to go out and ask these kinds of questions.
First Lady Ginkos, want to ask you, when you're looking at women in your own country, what are some of the top things you're concerned about, I guess both before the pandemic and now since the pandemic?
So naturally it's access. Countries like Namibia is very unique, where we have a very small population and a very large country. The country is about 824,000 square kilometers. For context, Rwanda is probably the size of our national park. So it's a huge country with very few people, second least populated, second only to Mongolia. So the delivery of health services to the population is expensive, and it's difficult because you're servicing such a small number of people in such a large country. So accessibility is a problem. Before COVID, it was also about a lot of the health services that should be there for women were non-existent. 57% of the women diagnosed with cervical cancer in Namibia die from cervical cancer. And this is painful because it is preventable. But as we've known now with things that are preventable, like with COVID and COVID-related deaths, there's a lot going on there around behavioral science, around the role of religious and cultural beliefs, So part of fixing health systems is also fixing what we believe in that prevents us from accessing health services.
Well, and so we have the health aspect of it also, and then we've seen the economic impact on women. And at least I know here in the US, it's been disproportionately women who have lost their jobs. What have you seen in Namibia?
Very similar. So disproportionately women who've lost their jobs, their economic livelihood, but strangely enough, what we've also seen with COVID is the same that we saw with HIV, where more women in Namibia are infected with HIV, but more men die. Same with COVID, more women are infected with COVID, but more men are dying. And the reason for that is poor health-seeking behavior from men. So that proves the point that when women do have access to health services, they utilize it and it saves their lives. So those are some of the reminders we're getting. COVID has created new problems, but really it's just highlighted old problems and exacerbated them.
Steve, going back to this index, so it's one thing to collect data, but obviously it needs to be usable for policymakers. Is this going to be usable for policymakers? And what kind of, do you have any ideas of policies you'd like to see result from this data?
Sure. We are trying to simplify it as much as possible, and again, Gallup is very good that way. But I do think what we've tried to do is boil it down into some simple areas around, preventive health, around screening programs, so that we really can, I think, start to put some simpler goals out there that we can start to track. Tracking how many women have at least seen a doctor or been screened for cancer, or for high blood pressure, for diabetes. Those things should be very measurable over time. And I think if we set the goals like anything, gosh knows if we put 10% of the effort that we have put in to fighting COVID towards women's health, we would make a dramatic amount of progress just in the next few years. And you can see it. And when the private sector and the public sectors come together, as they really have during COVID time, to go after something, and we need to make women's health that next area that we go after. Because to your point, especially the biggest thing we're finding also in the study, we don't have a baseline, but we all know judgmentally, women's health took a huge step back last year. Cervical cancer screenings way down globally. I think we heard the Merck team talking about that earlier. Breast cancer screenings way down. And particularly breast and cervical cancer are cancers that when detected early are so treatable. My own mother, is a breast cancer survivor. And as you get it early, it's different than certainly as you're speaking here about the cervical cancer deaths. They should be so preventable if we get them early.
Absolutely.
Monica, so you mentioned that women do seek care at higher rates than men, and we know that women are the healthcare decision makers often for their families. But have you found ways to, how do you encourage more women in your country to seek care, to make the right decisions for their families as well?
So a decision to have community health workers in the country has been quite consequential in enabling access for more women to seek health care. And the lesson there really is to use women as allies as opposed to looking at them as beneficiaries, particularly in the communities that are rural and generally a little bit forgotten about. The role there of these community-based organizations is critical. But their challenge is the lack of funding. So there is never a lack of international conference flying these women out to the world's capitals. But when it comes to providing these very same women funding so that they can implement what they talk about at these international conferences, there's a gap there. So I think it would be great to have more and more of those type of organizations that are based in these rural communities gain the funding so that they can actually implement what they come and speak to audiences like this about at conferences like this.
And how do you view your role as First Lady there? I know that you, for many years, have been involved in policy, advising, and anti-poverty programs, but can you tell us a little bit about what your role is now?
So I've kind of taken a decision as First Lady to have the conversations that upset everybody, simply because I can. And also because nobody wants to do it. So people who seek to either acquire or retain political office don't want to engage in difficult conversations which can lose them votes. Religious leaders don't necessarily want difficult conversations that may be against what they believe to be their religious doctrines. So if nobody's going to do it, I think I'm a great person to do it, because I know when I'll be out of this role of First Lady. So we have challenging conversations around reproductive health, around adolescent pregnancies. And what I liked, Steve, in your report is the data around how the age at which you have your first pregnancy fundamentally determines the health outcomes going forward. Now, in a country where I come from, where we have an adolescent pregnancy rate of 19%. This is young girls between the age of 16 to 19. You can imagine, and this is an old statistic, because again, data is a problem. Our last census was in 2011. We know that this number must be higher. So we focus on trying to make sure that we eliminate these challenges faced by adolescent girls and young women in accessing healthcare, but also decisions that have a long-term impact, not only on their economic well-being, but also on their health.
And I think always the danger in these conversations is sometimes for it to sound negative, in the sense that we're talking about all of these challenges, and we do know that this is the best time in history to be a woman. Can you talk a little bit about positive developments you've seen in terms of women's health, and what has been accomplished in terms of, I don't know, whatever you want to talk about, getting more screenings or other economic indicators or such?
So some of the positive indicators for me has been the involvement of women in political office. So we definitely seeing a lot more women acquire powerful political office. And I'm hesitant to say this is a solution, because we've also seen women gain powerful political office and then go through very interesting changes in how they look at issues like reproductive health. So getting the right women into political office has been quite good from a Namibian context. Something that I view as positive, not everybody views as positive. We've got a lot of young African feminist women who are speaking to politicians in a way I don't think politicians particularly appreciate, but they are getting the results because they are putting things back on the agenda that have been forgotten about, gender-based violence being one. And Stephen, your report goes through how sexual violence impacts health outcomes. So I'm certainly enjoying seeing young women on the continent, in our country, finding their voices and not feeling the need to be polite when they articulate their issues.
Steve, so your company obviously sells a lot of healthcare technology that benefits women. From your perch, how do healthcare systems fall short sometimes in screening women and bringing them in for preventive care? What kinds of solutions would you like to see? And the answer can't be buy more of your products.
Yeah, no, I think it is really trying to grasp the latest data that is out there. And, you know, I think we see in medicine, in some cases you have very recent data in so many things, in pharmaceuticals, this or that. But in other areas, and especially when it comes to policy, oftentimes we're looking at very old guidelines and very slow to change. And I think even if you think about, again, apply the COVID analogy, you know, the amount of diagnostic tests, vaccines, everything, incredible partnership between the private sector and the regulatory authorities around the world and the policymakers to really drive a lot of things forward. But then you suddenly get into cervical cancer screening or reproductive health screenings, and people retreat back and want to look at, you know, 10 or 15-year-old or 20-year-old data, or sometimes want perfect data instead of great data. And so I think just starting with it that way and really just making it a priority. And, you know, to your point of the young women who are starting to speak to the politicians, you know, speak to the policymakers, saying things that need to be said.
You actually you raise a really interesting point, which could be a whole conversation in and of itself, which is the frustrations we often hear at places like CDC, perhaps not moving as quickly as people would like to take into consideration new pieces of evidence. But Monica, do you have any of those frustrations in Namibia? Is that an issue at all, where, you know, you have your health agency trying to put out these recommendations for people, and then you have the scientists and the researchers who are saying, no, this is the latest data. Is that a conflict at all there?
So we're seeing that conflict more pronounced now in the time of COVID. You'll be surprised how a lot of talking points that we see originating from countries like America are seeping down into our social circles, and how they are echoing very problematic sentiments, which are difficult to unpack and explain. And it's having the same impact, where now you've got these groups, particularly the further away you get from urban centers, who believe in these ivermectins, and they believe in things that aren't scientifically proven. And it's because to many of us, I look at my father who's 87, he doesn't come from an era where a news agency can actually willfully spread misinformation. So if he sees it on TV, he's not concerned about what the source is. It's on TV, therefore it must be true. So I think the impact of misinformation from the developed world is much more severe in countries like ours.
You said something interesting when we were talking backstage that I did want to ask you about. And you mentioned this idea of misinformation and what that some of this is trickling down. And it made me, you were talking about the churches as well. And I know that here in the U.S., sometimes the administration has tried to partner with churches to get people vaccinated and things like that. Is that something that you've been able to do, or has it been a little more difficult in terms of those being places of misinformation?
So when we talk about the church, I can certainly speak from a Namibian context. We have the churches that came during the time of colonialism, Catholics, Lutherans, I'm a Lutheran, the more established churches. And there's been in the last 20 years a stream of charismatic churches. And a lot of these charismatic churches are adopting conservative American talking points on vaccines, on ivermectin, on it's satanic and all kinds of interesting versions. But it filters down to areas where governments don't necessarily have access to. It does play a role. So you're dealing with this exceptionally frustrating issue around vaccine nationalism, and then when you do get the vaccines, you need to negate this as well. But I'll be quick to add, Steve, that vaccine hesitancy isn't necessarily the problem. It really is access to the vaccines. But the role of misinformation in creating hesitancy certainly is starting to become a factor. And misinformation coming from religious circles in the developed world certainly is also playing a big role.
Well, we're almost out of time, but just I want to bring us back to this, idea of data and information that we're talking about. And Steve, what do you hope? What are your longer-term plans for this index? How long do you hope to keep it going? It sounds like this is just the beginning of hopefully a long project, but what are your ultimate goals for it?
Yeah, I hope, say by 2030, we can legitimately feel like we've made a massive difference in women's health in the world, right? This is not going to happen in a year. It's not going to happen in 2. I think we can start to make steps, but as we think long term, we've truly talked about this product, which is the Global Women's Health Index, may have a bigger impact on humanity than any product we've ever invented, which includes 3D mammography and all kinds of other stuff. We actually think if done well. And so I do hope, as my daughters grow up and all of our daughters, continue to grow up, that they continue to benefit from a far better healthcare focus towards women, and their needs are taken seriously and not kind of shrugged off, as I think just about every woman has ever felt at some point in some doctor visit in their life.